don't be afraid to stand up for what you believe in and what's right for the patient. So as a chiropractor, we get trained, we go through a pretty intense schooling, very similar to that of a medical doctor. And if you've never seen the comparison between medical education and chiropractic, I suggest you look it up, because hour for hour, it's very similar. They do more in chemistry and we do more in physical biomechanics. And when it comes to x-rays, chiropractors, hands down, are the experts. They were the first profession to use x-ray. But that education, don't be afraid to speak up and educate the public. Now, if you're educating each patient as they come in on their first visit and you're in there for 2 hours, you're going to scare them out of the office, because they're going to go, he's a nice guy, but I don't have 2 hours to spend with anybody. But there are times when I would educate, and I would do it through public lecturing. And I would research constantly, getting medical journals, medical studies, medical reports to be able to convey this to the public. And that's pretty much how I made my career. I was asked to do a radio show because of my ability to do that. But I remember back in the 1990s when things like cholesterol medication first came out. I started doing research on it. I remembered when I was in school, the cholesterol levels that were acceptable were different than what they were 5 years later or 10 years later. And I actually did a radio show with a compounding pharmacist, and I remember asking him, Ben Briggs was his name, great guy, loved what we did, was doing compounding pharmacy, which is a degree on top of his degree to help people avoid the side effects of the really manipulated drugs. They were mostly natural compounds. Anyway, I asked him, I said, have they been changing the cholesterol levels? And he said, yes, they changed them quite a few times. When he was in school, normal cholesterol was closer to 300. And I think when I was in school, it was 250. And he said there was a stop at 270 somewhere along there. But now, today, I've heard people saying normal cholesterol is below 200. And I also see studies saying that's actually dangerous, because you got to realize cholesterol is your body's ability to make its own fat. And you need fat. What do you need fat for? Well, fat is the ingredient in all of your tissues that makes them flexible. So most of your tissues are made from protein, and it's also made from lipo, or fat. So a lipoprotein is a fat-protein combination. So why is your body made that way? Well, it's this simple. It's so you can be flexible, so your skin can bend, so your tendons can stretch, your muscles can stretch. Your tissue has to be flexible, and the fat is the ingredient that does that. It also serves another purpose. It's waterproof. It helps contain liquid in the cells. It's also an insulator. It helps to insulate your nerves, because your nerves literally conduct electricity. So what part of your body conducts the most electricity? Your brain. And your brain is made up of two parts: gray matter, and then the increased part of it is the white matter. Well, what is white matter? It's fat, insulating your brain, because your brain is an electrical conductor. It's like, it's not a generator, in my opinion, it's a transformer. It's transforming the essence of life, whatever you believe that is, I happen to believe it's spiritual, into a body. So you're taking that energy, which is not even energy, it's just that essence of life, and getting it into the body, and the vehicle that does that is the brain. It's the transformer. But because that energy is electric, literally, it's got to be insulated so you don't short circuit. And fat not only covers your brain and all the pathways in your brain, but all the nerves in your body. It's called myelin. Myelin is the covering around nerves that insulate it and protect the electrical current from not shorting out. So when people lose the myelin on their nerves, it usually happens in the distal nerves first, which would be the toes. And that's called neuropathy, losing the fatty covering on the nerves in the distal part of your body. And if you take a drug like a cholesterol lowering drug called a statin drug, it's going to interfere with your body's ability to make that fat, which could be one of the reasons why so many people now have neuropathy. Now, call me crazy, but back when I was saying this in the 1990s, and I was saying taking these drugs could cause dementia, people said, you're crazy. That chiropractor's crazy. I had medical doctors telling my patients, don't go to him. He's crazy. Well, now the studies are coming out saying, yes, indeed, those drugs can lead to dementia. And I'm going to go one step further and say, if they can cause dementia in the brain, they can sure as heck cause neuropathy in the feet. And we have a lot of people that took those drugs. It was the most widely prescribed drug in the world for a long time. And now we have a whole group of people that are in their 70s and 80s suffering with neuropathy, which is the nerves in their feet don't work anymore. They can't feel their feet. They can't keep their balance. They go through episodes of pain and sensation change. And then I guess the pain stops, but so does the function. And now they have no balance. What's the number one cause of death of senior citizen? Falling down. So before you put a drug in your body, you better do some research as to what effect that drug is going to have. And don't ask the drug companies, because back in the 90s, they were saying these drugs are completely safe. And just like they said, the opioids that were released by, like OxyContin, was not addictive. Just realize that marketing arm, their job is to sell that drug. And it's usually the marketing arm that handles the side effects of the drug so the patient doesn't get scared off of the drug. You need to educate yourself about these drugs, and you need to trust, as a chiropractor, your education to educate your patients about them. Because I've had a lot of people come back to me later in my career and say, I thought you were crazy when you said this 20 years ago, but now I see these studies that are proving what you said was true. So don't be afraid to stand up for what you believe in and what's right for the patient. Patient first, compliance second, profits third, but one follows the other.